Hi everyone. A very good evening to all the aspirants, all the students, all the doctors who are listening to this live feed. I'm Dr. Sandeep Sharma, your pediatrics super specialty faculty at Prepladder. So the battle cry has been given. NEET super specialty is now going to be held on 1st and 2nd of September. I'm quite sure that most of you have already seen the information bulletin, and you would be knowing that the pediatric exam is due in the second half of 2nd September. So you get 1 day bonus if you like, if you want to see it that way. So this session, I'm going to talk about a lot of things. So before I start with the session, I hope I'm audible and visible. The comment section is open in front of me. I have one of the windows also open in front of me. Whatever doubts, whatever queries you have asked before, I'll be taking it up. And whatever queries you will be asking me live, to the best of my ability, I will be answering them as well. Please like and subscribe to this video because in the coming days, I'll be coming live multiple number of times and we'll be discussing some of the queries in a live interactive way with you. Uh, this will include academic sessions also and all the topics which you feel they are important from exam point of view and you somehow feel that they have not been covered somewhere, someplace, or Nelson is creating an issue for you. I'll be more than happy to take them in a session like this. So this session it will be divided into three parts. Initially, I will be talking about some snippets related to examination information. Then I'll be talking about some academic queries, which you have already asked in my Telegram group, in the Facebook group of Prepladder. And then it will be an open house discussion. I'll be looking at the comments and I'll be taking up all the things, all the points which I want to mention. So let me just start with the session. First of all, the exam is going to be held on 1st and 2nd of September. And a lot of students have asked me, it is mentioned in the prospectus itself that the cutoff by which you should have completed your MD or DNB is 15th of September 22. So be careful about the date, about your eligibility. Even those people who are preparing for super specialty but are not yet eligible, this discussion which we are going to have, you are going to get some important input. So stay hold. The changed pattern is there. So, as compared to the previous super specialty exam of NEET SS, now you will have a so-called group-based exam this time. So, when I say a group-based exam, it basically means that now it will be the broad exit exam level of questions which will be asked to you. If you look at the prospectus also, they very clearly mention that the general part of subject, that is pediatrics, will be there. Also, there will be subspecialty related questions. So, contrary to what some of the students were thinking or assuming that it will only be a general pediatric kind of question, that does not change much of the things. If you look at the past super specialty NEET SS papers or their similar recall questions also, you will find that it was always a mix. What are the differences now? The paper pattern has changed. It will be 150 questions in 2.5 hours. So it will be 150 questions in about 150 minutes with the negative marking being same -1/4. So effectively you have 1 minute for each question. They've not clarified it, what way it is going to be, but it will definitely be a mix. There will be clinical scenarios, there will be some images, there will be some lengthy questions, and there will be one-liners. So it is expected to be a mixed pattern. If in case there is any change in the pattern, obviously it will be the same for everyone. So the point is not to panic. All of you are pediatricians or going to be pediatricians, and so you have given multiple exams, you have conquered all the exams. So this shouldn't be a botheration for you. So those of you who are out of practice, now is the time to compile everything and practice some MCQs real seriously. And there is also a demo test they are going to have. The date is mentioned in the prospectus, so please do give that demo test, taking out time for the NBE before you sit for the exam, because demo test will give you a clue how the exam is going to be. Even if the same questions are not going to be there, at least you will get a air of the exam. So this is regarding the exam that I wanted to ask. Let us move further. I am getting a lot of comments from you students also. So I will be taking up the comments after I am done with the already asked queries, after I have responded to them. So in about 5-7 minutes time, I'll be taking up all the individual queries, right? So first of all, uh, one query which was asked multiple times by two students was, what is the best source to read about poisoning? Is it Ghai? Is it Pals? Is it Nelson? See, there is no clear cut answer here. You would be surprised to know that yes, OP Ghai is actually very good for compiling for a quick review of all the childhood poisonings before you sit in the exam. So if you have not gone through it, for a quick review, Ghai is actually good. Certain parts of Pals can also be incorporated. In case of Nelson, you don't need to read the entire Nelson, but there is a chapter in Nelson called as non-bacterial food poisoning, where mushroom poisoning and similar poisonings have been mentioned. So those poisonings, although they haven't been asked in the last 2 or 3 years, if you look at the older papers, if you look at the older INISS recall questions, there have been questions asked from that particular chapter. So non-bacterial food poisoning, just go through it once and all the key points, if you can find, just add them if you are preparing a childhood poisoning kind of questions. Having said that, there is AIMS PICO protocol, which I'm quite sure most of you are reading. In AIMS PICO protocol, scorpion bite and snake envenomation, you need to read thoroughly, especially related to scorpion envenomation. If you read 5 different books, you will find 5 different types of protocols being mentioned for the use of prazosin. Prazosin is the drug of choice for scorpion envenomation. I'm not going into details right now, but the protocol which is mentioned there in AIMS PICO protocol, that is the one you are supposed to follow. In case you are having the older edition of AIMS PICO protocol, you need to read the latest one. But in case of poisonings, as far as I know, there isn't much of a difference. So it is going to be a mix of the things that you're going to read for a quick revision. Yes, OPGAI along with selected portions from AIMS PICO protocol, they are going to be effective. The second query which I got was, what is the dose of vitamin K in neonates? Now, you need, when we say dose of vitamin K, you should be very clear. Uh, National guidelines, the Indian guidelines, Government of India guidelines, they very clearly say that vitamin K should be given parenterally to every child at birth in any institutional delivery. The dose in all children is 1 milligram intramuscular of vitamin K1. It should be given anterolateral thigh. It should be given on day one within 24 hours of the birth, ideally soon after birth, in a healthy child, obviously. And you should be using a 26 gauge needle to give that. In case the weight is less than 1000 grams, in case it is a extremely low birth weight child, only then the dose will be 0.5 mg. Otherwise, the dose will be 1 milligram, and there shouldn't be any further controversy on this. Different countries have different guidelines. In India, we are following these guidelines. This is also called as prophylactic dose of vitamin K. Another is therapeutic dose of vitamin K. Therapeutic dose is something which will be asked to you in a question. Therapeutic dose means child is having VKDB, vitamin K dependent bleeding. In vitamin K dependent bleeding, Nelson very clearly says 1 milligram parenterally. So dose is very clear. Prophylactic also 1 mg, therapeutic also 1 mg in newborns. In newborns, I'm talking about older children, you can use higher doses as well. Right. So, moving further, the next query is, how will you distinguish between duodenal atresia versus malrotation clinically? I've answered it before, but I'll answer it again. See, duodenal atresia, the incidence is 1 in 10,000 versus malrotation, the incidence is 1 in 500. So, malrotation is much more common. Practically speaking, both can present with bilious vomiting, and only on the basis of history alone, you cannot distinguish between the two. In fact, even if you look at the abdominal finding, if you get a X-ray done, you will find that in case malrotation is having an element of duodenal obstruction, they will also have a double bubble sign. So presence of only double bubble sign cannot distinguish between the two as well. So there will be in MCQ, if you are talking about NEET super specialty MCQ, or you're talking about any MCQ, in fact, they will always give you clues like the child is having no abdominal distension, but bilious vomiting on day one. It is a Down syndrome, prematurely delivered child. All these are risk factors for duodenal atresia, and so the likely diagnosis will be duodenal atresia. Having said that, if no such information is given, you have to follow Cloherty. Cloherty very clearly says, remember this line. It is taken from Cloherty, and it's a line which I have been taught when I was doing residency, and I still remember that line. It has been there since last 4 editions of Cloherty. I'm not that old, but it has been there since last 4 editions. It clearly says that biliary atresia, that your malrotation should be the first possibility that should be considered in any child presenting to you with bilious MSS in neonatal period, unless proven otherwise. Understood? So malrotation should be the first possibility in case you have no other likely possibility. It is more common and it has a more wide, manifestations compared to biliary atresia. Compared to duodenal atresia. Moving further, query was asked regarding most common cause of septic arthritis. I was asked about neonatal period. I was asked about uh, older children, but less than 4 years. Nelson 21st edition clearly says Staph aureus is the most common cause of septic arthritis in all age groups in the pediatric population, right? Fluharty also says that in newborn period, when it mentions the organism, it first mentions Staph aureus, then mentions gram-negative bacilli. So your answer will always be Staph aureus. Regarding Kingella kingae, there is some doubt in the minds of certain individuals. If you read Nelson says Kingella kingae is a relatively common cause, which is now being detected due to better techniques of PCR. It does not say that it is more common than Staph aureus, as some of the guides and some people tend to assume. The answer, very safely, it is Staph aureus. Trust me, examiners are very particular when it comes to taking references. Anything mentioned is Nelson, unless it is a deviation, unless your own guidelines of Government of India, they are different. You should be following Nelson in all particular scenarios. So answer, Staph aureus, no doubt about it. So, about the next question, Fragile X syndrome inheritance. Now, Fragile X syndrome is a trinucleotide repeat disorder, and to label it as only X-linked dominant or X-linked recessive, frankly, that is not, that's a very easy way out. You know that trinucleotide repeat disorders have their own way of classification. You can have normal number of repeats which does not cause disease. You can have intermediate forms. You can have pre-mutation form, and then you can have the complete mutation form where there are more than 200 repeats happening. These more than 200 repeats of trinucleotide, they are the one who are going to have the fragile X syndrome. And if you are asked in general, the best answer will be X-linked dominant. The same thing is mentioned in multiple sources. It is not mentioned directly in Nelson, but X-linked dominant is the mode of inheritance. That is why it occurs in females also. Less commonly, obviously, but can happen in females. More commonly seen in males. And X-linked dominant inheritance is described for the complete spectrum X fragile X syndrome, right? So I've talked about 50% of the queries you had already asked. Now I'll be taking intermittently so that you don't feel left out about the questions that you are asking from here. So let me start with Hi Ankush, Hi Aditya. About all the controversial updates in soft copy, Aditya, I'll try to compile that. Uh, Dr. Fawad, great love from Pakistan. Hi, Dr. Fawad. Nice to talk to you. Hi, Dr. Govind. Hi, Dr. Ankush. Downy and Silverman scoring can use till how many days after when babies on CPAP? Yes, Govind, either of the two can be used. Examiners are particular about Silverman Anderson score. Even in AIMS entrance exam and in clinically, we use Downey's more. But in entrance exam point of view, Silverman is asked more. Either of the two can be used in real clinical practice. And you need to remember both of them. You can't choose one over the other. You have to read both when it comes to entrance exam. Yashwant is asking, please tell a strategy on how to prevent, like only Prepladder is sufficient, or should it be a mix of Nelson and Prepladder? Yashwant, uh, please understand, no single source or no single course or no single teacher can ever be, all in one thing. So, although we do try to cover as many things as possible, and in the coming days, we'll be coming up with more videos, more content as well. Having said that, any prep ladder or any coaching institute cannot be a substitute for reading yourself. Nelson has to be read, no doubts about it. In case you want to compile Nelson, in case you want to revise, in case you want, helping hand, which simplifies Nelson, then Prepladder is the tool you should be looking out for. So, end of the day, it is not a substitute for Nelson. So, let me be very clear about it. Aditya is asking list all the controversial updates. Aditya, as I said, that is a separate thing. I'll definitely consider putting them. Anuj, sir, video mirrors like hematology against subs SCA thalassemia. When will they be updated? Dr. Anuj, sickle cell anemia has been recorded in full details at least many weeks back. That almost winter season it was recorded. It was available also, but I think it has gone missing somehow. I'm right now sitting in the Prepladder office. All the queries which were there, the missing videos and everything, they have been communicated in person before 1 hour before this session has started. Regarding thalassemias, that video was there from the medicine faculty. But now that the exam pattern has been changed, so medicine videos have now been removed from the pediatric part. So I will re-record the thalassemia part specifically, and I'll put it up before you sit for the exam. Don't worry, it will not happen one day before. It will happen in the coming few days itself. Uh, Dr. RD is asking out of 150 question PG exit level, 1 to 2 is sure shot to come. Please take a small video on biostats. See, we can consider a video on biostats. I'll have to talk to the management about it. PG exit level, already if you have given the INI super specialty paper, there are questions asked from biostats in that. Other than that, I think this is something we can consider. I'll have to talk to the management about it. See, end of the day, I can't take such decisions myself. Sanket Bhadra is asking, sir, for many days, stress dose of hydrocortisone in nephrotic should be given. What is the best method of dialysis in both hemodynamically stable and unstable patients? So, Dr. Sanket, I have taken your query. For this, I'll have to check the references. I don't claim to know everything. So, for the controversial things, I don't think I'll be. Let me be very modest here. I'll answer academic questions only if I know the answer for sure. If I don't know the answer or if I have to check it, I'll be telling you that have a look and update in the coming days in the next session, or I'll update on Telegram channel itself, right? But I'll not be telling you anything wrong. Uh, Being pediatricians, I'm quite sure that you know that whenever in doubt, even if it relates to dose, you should always be referring to your dosage charts. And I think the same rule should be followed in controversial questions as well. Regarding the best method of dialysis in both hemodynamically stable and unstable, what do the latest guidelines say? I'll have to check for that. Govind PS is asking, is Achievers course active? When is it restarting? How to join? Govind, Achievers course is for INI, CET, and NEET PG preparation, not NEET SS preparation. So this session is for SS, but yes, Achievers course, I could not be a face of it because of multiple reasons. As far as very authentic information goes, yes, Achievers course will be coming very soon. In a couple of weeks, you'll come to know. But this is about super specialty, not PG thing. Muhammad is Shadiq is asking, is it okay to read from 20th edition Nelson and all? The answer is yes, if you are reading about concepts or drug dosages or in general. But the answer is no, because there have been certain changes in the 21st edition as well. The better way will be in case you're reading from 20th edition, you can read from there. But if there are any updates you can find, or if you can follow the latest videos which we are uploading on Prepladder, you can, all of them are according to 21st edition itself. So corresponding changes you can make while keeping the Nelson and reading from the Nelson in front of you. So make use of those sticky notes, right? We have to read 21st edition Nelson. Any role of beta agonist TTNP there is, but no role clearly according to Cluharty new edition. RD say, see, RD, it is a controversial thing. According to Nelson, there is a role of salbutamol because salbutamol increases the expression of the channels which have been found to be down regulated, and responsible for causing TTN. Yes, new edition Cluharty says this is one area where there is no consensus. What are we doing right now? In case of TTN, normally it is not needed, but any TTN which is persisting, and in case there is a what is happening right now is, in case the patient is improving only on head box oxygen, we are not giving salbutamol currently. Now, this is a very individual subjective opinion, but it is based upon what most of the neonatologists and practicing people in my knowledge are right now doing. If the patient does not require head box oxygen, or if there are no other comorbid factors, we are not giving salbutamol to the patient. Having said that, Having said that, in case the patient is having any risk factors like infant of diabetic mother, or in case you find the patient is not improving or there is a need for CPAP, a trial of salbutamol can definitely be given, and off-label it is being used in certain centers. When it comes to entrance exam, particularly NEET SS, if the question does ask you to take one side, then it will depend upon how the question has been framed. So if the question is asking you which of the following has a role in the management of TTN and salbutamol is mentioned, the most likely the question has been framed from Nelson and you have to answer yes, salbutamol has a role. But in case there are statement based questions, and in case you find that there is a better answer and one of the option is saying salbutamol has a controversial role, here you will be following going according to Cloherty, because end of the day we don't know what examiner is going to use or what examiner is going to ask you, right? So moving further, and please, I keep on repeating it here, like, subscribe, so that you keep getting all these notifications again as well. So Subhasis Haldar is asking, is it wiser to see the videos before reading Nelson or watch videos after reading Nelson? Subhasis, it is entirely up to you. Ideally, you should, most of you have read Nelson already. So just quickly, if you listen to the video and then give a quick review of the Nelson, that particular chapter, I think it will save time, because the key points of Nelson you would have already seen there. In case you find any additional point which I've not mentioned, but you feel that it is important, it is there already, you will be able to, add it to your own personal notes if you are making. So this is one approach. But again, anything works. What will be the distribution of marks according to specialty? Meenakshi is asking. Meenakshi, they have not given the distribution of marks. They have kept it ambiguous. If you see what NB is doing in NEET PG exam, the new prospectus, which last exam which happened, they did not mention the distribution. Ki pediatrics se kitna, OBG kitna. They have not given that. Similarly, in super specialty also, they have simply said exit level. They haven't told you neonatology kitna, general pediatrics kitna. But in general, we assume that general pediatrics and neonatology will have slightly more bulk because you have more number of papers, questions being asked from these sources. Having said that, there will be questions from childhood psychiatry also. There will be questions from hematology, pediatric oncology, and so on. So a balanced, all-encompassing approach is needed. You can't say that am good in neonatology, so I'll only do neonatology, and I don't like a particular aspect, so I will leave that. Which book to read for NEET SS Pediatrics? Faraz is asking. There is unfortunately no MCQ book available right now, but off-label, a book may be coming soon for SS Pediatrics. That is all I can say for now. So do we need to read any other book apart from Nelson? Subhashis is asking. Yeah, Nelson is a must. Flaherty, Ames PICU Protocol, PALS guidelines are optional. Selective addition of selected parts of Park's pediatric cardiology also you can add, right? How to prepare neonatology section, Sonali? AIMS neonatal protocols have to be done along with selected parts of Cloherty. Infections part has to be done from Cloherty. Temperature management, pain management has to be done from Cloherty. And respiratory disorders, neonatal jaundice has to be done from Cloherty. In addition, infant of diabetic mother, both Cloherty and Nelson will be needed. Brachial plexus injuries in newborns, cephal hematoma, subgaleal hemorrhage, Cloherty you have to read. So make it a mix of Cloherty with AIMS neonatal protocols, and I think it should be enough. Good evening. Anas, I cannot seem to find previous year questions in the app. Anas, because there is a problem in the recall of previous year questions. But yes, that is a point already taken and the management is looking into it. In the Q bank already we have included some of the questions. Uh, then Abhishek is asking how to maximize score with minimum efforts. Kindly tell Abhishek, that is a ideal thing to do. That is a utopia. That is like, कम काम करके मैं ज्यादा पैसा कैसे कमाऊं. Everybody is looking for it, but nobody knows how to frankly get it. See, the point here is all of you are pediatricians, many of you are already working, so it will be difficult for you to take out 12, 14, 16 hours a day on a consistent basis. So what is important is you be very specific in your preparation. First of all, define a timeline, how much time I have. Then you break it up into two parts. One is the time during which one reading should be done, and the second part should be reserved for revision. And in between, you should be solving MCQs. As I said, each system is important. So you'll write down how many systems are there, and each system, the most important things have to be done. If you look at the last few papers of NEET SS, you will find that it is not a very rare questions which are being asked. Questions which are being asked which are predictable. At least 80-90% paper is predictable. Something which is difficult, unpredictable will be there for everyone. So the smart study says whatever is likely to be asked, your accuracy in that should be good. And regarding syndromes, there is no limit to the syndrome, but at least the important syndromes ranging from the trisomies to Noonan, Williams syndrome, etc., Charge syndrome, Dye-George syndrome, the common ones, the relatively common ones. Ehlers-Danlos syndrome. Ehlers-Danlos syndrome had three questions in the last NEET super specialty. So you have to focus on these areas a bit more. Having a look at the recall session which I had done some months back of NEET SS will give you a clue how questions are being asked. So you can have a look at that session after the session is over. Michael K is asking, "Hi, my guru. I'm from Balkan. Why don't you don't make some clinical with real patient? We also need emergency video with drug doses." Michael K, making clinical videos with real patients in pediatric population is a bit tricky. There are sometimes you won't find the kind of patient you are looking for. Sometimes there will be compliance issues, consent issues. Those kind of issues are there, but yes, we'll be definitely doing something about it. In fact, I have been you know itching to get some clinical patients as well, because I belong to the old school that true learning of any subject, true learning of any clinical thing should always be done on patients and not on an app or in a teaching studio. So this app, this all thing is only to supplement you, to help you in cracking your exam. If you want to learn about pediatrics, it is your patients which are going to teach you, right? So in between, I've taken some questions, or a lot of queries are coming. I'll have to go fast. I'll also be answering some of the queries already given to me, and then it will be entirely the live chat that I'll be taking up. So RDA, according to protein intake, is done in which vitamin? This was a recent MCQ also. The answer is vitamin B6, that is pyridoxine, right? Another academic query. One student asked, "Sir, breakthrough UTI में ग्रेड 1 या 2 VUR है, would it need surgery or you we need to give continuous antibiotic prophylaxis?" You need to understand, if the question is saying breakthrough UTI हुआ है, breakthrough UTI automatically means the patient was on antibiotic prophylaxis, and now the UTI has happened. So you will have to consider surgery in the patient, right? Even if it is a low grade VUR according to the current guidelines. But obviously, you will not directly jump to surgery. The first management in VUR will always be antibiotic prophylaxis. Another question asked is, most common CNS tumor in 15 to 19 year age group, is it pilocytic astrocytoma or pituitary tumor? Nelson itself is saying in one of the plays that pituitary tumors are about 23.2%, and pilocytic astrocytoma is only 10.5%. So if you have to choose one among the two, pituitary tumor will be the better answer in 15 to 19 year age group. Write it down somewhere. If you're not writing, you can listen to this video again and you add it to your existing notes. Drug of choice for lupus nephritis, I've already told you before, there is no single drug. A combination of immunosuppressants ranging from steroid, mycophenolate, etc. should be read. In addition, if you want to read in details, 2020 Indian Pediatrics, there is an article on lupus nephritis. You can Google it, download it. It's a very good article. Details have been mentioned there. And then somebody has asked, sir, pulmonary TB treatment may they have mentioned weight band as 4 to 7 kg, one FDC fixed dose combination tablet, and 8 to 11 kg two fixed dose combination tablet. Agar weight 7.5 kg hai to kya hoga? There is no clarity in this, but in general we assume that if the child is 7.5 kg and you have to choose one among the two, you better go in for the slightly higher range. Higher range means it's a child, the weight is going to increase, and already he has crossed the lower limit. 4 to 7 pe jo dena tha, that was 1 FDC. it has already crossed. The guidelines are unclear on it, and it is highly unlikely the examiner will ask something controversial like this. But if you ask me, my opinion is you should be going answering it according to 8 to 11 category. Again, this is open for debate. And lastly, somebody asked about medial longitudinal fasciculus injury. It's a subtopic in itself, difficult to discuss in a live session. Medial longitudinal fasciculus is involved in horizontal gaze uh, integration, the saccadic eye movements it is involved, and any injury to it causes internuclear ophthalmoplegia, which causes abduction and nystagmus related problems. So, medial longitudinal fasciculus, yes, there was a question in the exam. So, as a small short review, I'll be putting it up shortly. So, these are the queries which were asked. Now, let me come back to your open house queries which you are asking. So, where were we? The Beatles, respected sir, when will other videos of neurology will be uploaded? If you're asking about pediatric neurology videos, the some of the videos, yes, the previous faculty videos, as soon as their copyright thing is done, I'll be recording selected portions of it, and I will be uploading them. Some of them are already available, some of them are in, post production. They are there. Then, how to revise Nelson in 40 or 45 days for someone who has read Nelson line to line. RD, if somebody has read Nelson line to line, you must have marked certain things as important. My suggestion will be identify the areas from where questions are repeatedly asked and then start reading those particular chapters. You can omit the chapters related to adolescent injury, those related to the first 4 or 5 chapters related to ethics, etc. Ethics are important, but they are not important from entrance point of view as a topic. So in real life, ethics are the most important thing, but from entrance point of view, you can leave out a few topics like those. Also, the parts of eye, ENT, dermatology, orthopedics. These are the parts which are covered in Prepladder videos. You can go, you can follow them. Reading them from Nelson, if you have time only, then go for it. In Nelson, you should be focusing on the highly asked areas, frequently asked topics. Again, this is virtually impossible to revise Nelson in 45 days. Radioactive iodine uptake in Pendred syndrome will be increased or will it be normal? Is it a yes, Sarat Soni? It is a dyshormonogenesis. It is classified as one of the categories of dyshormonogenesis. There is a problem in sodium potassium, the symporter, which is involved in sodium iodide symporter. The same protein is absent in the cochlea also and in the thyroid membrane also, and that is why it is considered as one of the dyshormonogenesis. Anas Mohammed, question bank has many formatting errors. Accent, nothing less than accent. Thank you, Anas. I just had a meeting with the in charge of QBank. I explained to her all your queries. I have sent the snapshots uh, to her, and she has assured me. And I've also informed the topmost management that there are things which need to be updated, which need to be improved, especially in neurology and oncology, Prepladder, Q Bank in super specialty. They have assured me it will be done as early as possible. In case it is not done, please let me know. I'll keep hounding the team for that. What will be distribution of subspecialty? Abhishek, I've already told you. And NB hasn't mentioned it. Sarvan Prabhu, video about lipid storage disorder. Yes, mucopolysaccharidosis. I'll make a quick video for that. Is this course helpful for PG theory and practical exam? Ravi, for PG theory, yes, because it is based upon Nelson, it will be useful. For practical exam, answer is no. Practical exam, there are no clinical cases here, and how to examine a patient, we have not discussed anything because those things are not asked in super specialty exam. For practical exams, there are some courses which are in the offing at our end also and elsewhere also. Nothing is right now, a resident thing is there. So for practical exam, this course is not there. But for theory, because it is based upon Nelson, it will be helpful. Sir, when will the notes of cardiology be? As we have only arrhythmia notes as of now, Dr. Sandeep Mori, I'll have to ask the content team because I'm not a part of the entire loop of creating notes and dispatching to the students. I know about them even little as little as you know, so I'll have to ask them about it. Cubanks. Satish, as I've already told you, I have updated them. All your queries have been conveyed to the team. Uh, Saras, only 150 question will be having equal distribution of all topics this time. The answer is not likely. But again, you have to follow the previous papers. Nobody knows because it is the new pattern first time happening, so nobody knows about it. Try to recognize. Satish, yes, you have tried to talk to management. I have also talked to them in a serious way. I have talked to them in person today. Normally, I have been communicating them or sending an email or so. Today, I talked in person, and I've also like sent all the snapshots, not like a reminder, sent the snapshot that these are the queries, and I've also informed the topmost management about it that these issues are persisting for quite some time. So expect some action in the coming days. How many grant tests to give per week and how to plan revision in 45 days. Now, this is a practical thing Dr. Neeraj has asked. Uh, Starting from today, you have about 40 days. So, what I would say is 30 plus 10. That is the most practical thing I can advise. 30 days, finish one quick reading of all the systems. 10 days, only selected areas from where questions have been asked in the last few NEET super specialty exams and your problem areas, right? Now, when I say 30 days, you have neonatology, general pediatrics, you have nutrition, you have pediatric cardiology, neurology, nephrology, rheumatology, immunology, about and if you go on counting like this, then you have smaller ones like pediatric eye, ENT, skin, you can combine as one, oncology, etc. So total there are about 12 to 13 specialties broadly that you will find, 12 to 13 roughly. So that means about 2 to 3 days for each specialty is the maximum time that you can squeeze in. Obviously, neonatology will take 1 day extra, and something like uh, pediatric hematology, except for the or maybe pediatric oncology, will not require equal amount of time because there are limited number of tumors which are you are supposed to do, only 7 or 8 tumors that you're supposed to do. So you need to balance it accordingly. Try to finish. This is where your prep ladder videos are going to be beneficial for you. Whatever we have done for super specialty, and as I promised, this is the first session of this kind which I'm taking. Trust me, very difficult to answer such queries, so spontaneously. But this is one initiative from our end, and I'll be coming up with more live videos. I'll be coming and discussing, since many of you requested for it, obstructive uropathy, quick 1 hour revision program. I'll be coming soon. The day will be notified soon. I'll be coming live, teaching you all the key points. So you can listen to that video and update your notes. And in case you have any doubts, you can always ask immediately there about that topic. So similar such sessions will keep doing, and you need to keep practicing also. And regarding grant test, at least every 10 days you should be giving one complete uh, pattern of test. One demo test will be uploaded by NBE, so that will be another mock test for you. We'll also be planning a mock test at Prepladder for you, so that also you can give. So about three or uh, practically 3 to 4 grand tests are the maximum that can be given at this moment. What is the current management guideline on Shapiro syndrome, consistent hypothermia? Aditya, I'll have to check for that. I'm taking snapshots of whatever you are asking. I'm taking snapshots of these, and I'll definitely reply to them afterwards. Mahesh is asking, sir, we get another hardware for the new videos that are being updated. Mahesh, frankly, no idea. Notes team is separate department. I don't even know who people are working there, so I'll have to ask them. So, according to Ren's pair, frozen ratio should be 15 is 2, but in your lecture you said if single is 13 is to 2, please confirm. Abhishek, yes, there is a difference in the guidelines. In BLS, they are saying that it should be 15 is to 2 for both single and double rescuer. But at a certain other place, they are also saying that in ACLS, it should be 30 is to 2 and 15 is to 2. So that is a controversy which was there in the draft, according to which we had prepared the video. So a clarification on it, along with the relevant references, that will be put up in the app itself. In the app where the video is there, the clarification and errata related to it will be put up there. Should NSC be given in all cases of ALF? Sarthak, it is a very controversial decision. It is not given in all cases of ALF. It is not given. It is not. Is this course helpful for junior resident? Ravali, I just told you. In case you are preparing for super specialty or fellowship in the future, or even MRCPCH, although the theoretical part, it is going to benefit you for your university exam because it is based upon Nelson, Parks, Flaherty. It is going to benefit you. But if you ask, sir, pediatric practical course, I want to learn how to take history, how to do management, clinical protocol, fine details, how to manage a patient who comes to you unconscious, or how to manage a cleft palate patient who's just been born. Uh, that part we have not discussed because that is this course is oriented towards super specialty entrance. So that part is not there, but still, if you want theory, you'll benefit. Which MCQ book to be read? Frankly, there aren't many MCQ books out there related to super specialty. There is one book, if you can want to Google, you can find that book easily. So related to super specialty past papers. It does not have all the past papers. It has a lot of neonatology questions, which are self-framed, not actual questions from the exams. And there are no explanations to the past super specialty papers. With this in mind, again, I'll say there are some books in which are coming up, but again, I can't, announce it anything officially right now. For MCQ practice, whatever source you have, pediatrics questions, whatever source related to to your NEET PG level, if you have, you can follow them only for practice because the time is also limited. So you cannot overdo the MCQ part also. For pediatric college, should we follow AHA and PALS? Yes, Aditya. Wherever there is a doubt, PALS guidelines should be followed. Kamalpreet, if you want DM, whether we have to learn medicine along with pediatrics. Kamalpreet, according to the new standard, if you want to do DM endocrinology, adult endocrinology, you will have to sit in the medical group exam. And for that, you will have to read Harrison. You will have to read adult medicine part as well. That is how the paper has now become, right? They've given the example also. For example, you want to do, you want to be eligible for both DM pediatric endocrinology and DM endocrinology adult, right? So you will have to fill both the forms. You'll have to pay the fees accordingly. You'll have to mention it in your uh, paper that you want to sit for both the categories. You have to mention it. You can't decide later on, right? So for adult endocrinology, you will have to appear in the paper for medical group, the adult medical group. That is due to be held in the first half of 2nd September. Then for pediatric endocrinology, you will have to sit in another paper in the evening. That will be the pediatric subspecialty group where you will be sitting. For the medicine part, for the pediatric part, obviously the pattern which you know will be coming. Only pediatric questions will be asked. But in the adult part, if you are targeting DM endocrinology, you will have a common paper related to adult medicine. For that, you will have to read Harrison, all these subsystems of adult you will have to read. You'll have to read about MI and stroke management also. Last year, topic-wise marks distribution in NEET SS, Anish, roughly it was a very balanced paper, but there were certain topics from where a lot of questions were repeated. If you look at the past paper, Alagili syndrome had 2 to 3 questions. Uh, Tubular disorders like Bartter, Gitelman syndrome, Liddle syndrome, they had 3 to 4 questions. Then there were questions asked from poisonings in children very frequently. There were 2 to 3 questions from uh, arrhythmias, which were directly asked based upon the protocols and the side tables given in PALS guidelines. Then there were 2 or 3 questions which were attributable to the AIMS PICU protocol. Then there were questions related to neonatology, the simple questions related to your simple neonatal resuscitation and so on. So these are the, so if you see these about 10, 12, 13 questions are there only from a few topics. So you are advised to have a look at the video of recall, which I have already done, and identify the relative uh, distribution. Whether the same distribution will be followed this time or not, we frankly do not know. Bhim Singh, please upload recent update on HIV and TB. TB I've already uploaded. Please have a look. TB I've already uploaded 4 months back. HIV guidelines, there is only a new update related to infants and neonates and about the feeding guidelines that I'll be uploading. Is Nelson and that is due for recording actually. Nelson and prep video sufficient for cardiology? Yes, Shubhangi, I think Nelson plus prep should be enough. Please share the guidelines or ROP latest one. Sanket, ROP latest one, AIMS, there are multiple guidelines available. Usually the AIMS neonatal guidelines are the ones we refer to. But in case you want me to take them up again, I'll take them up. OP and scorpion poisoning. Uh, I like scorpions, not like them, but scorpion envenomation and its poisoning and all. Um, I had that case. I had that particular case, and I've given presentations in my PG days, and still since that time, for an unknown reason, maybe I was a scorpion in my previous birth, but I have been reading well about it, and I like to teach that. So I'll ask the Prepladder team over here so that in case they want me to schedule a session where I key points related to that can be summarized, I'll definitely try to take them. Sir, infection is a big chapter. Can you tell the important topics and important updates to see? Yes, Shubhangi. In infections, TB, HIV, TB, IAP, and TEP guidelines, right? Have to be read. HIV, recent changes, and diagnosis of HIV in children has to be read. In infections, all the viral infections with a rash, their DD has to be read in full details. How to make the diagnosis, how they differ from each other, and so on. For example, fever on day one with cough, coryza, conjunctivitis, and enanthem appearing soon after. Immediately, even if the question is not completed, it should be clear measles is being talked about. If it is a non-itchy rash with no vesicle, chickenpox should immediately be ruled out. So such kind of accuracy is needed in viral rashes. So viral rash DD has to be done properly. Then Epstein-Barr virus is very important, and I hope you know that Epstein-Barr virus has recently been linked to development of multiple sclerosis also. EBV is a hot topic. Please read it properly from your books. Uh, if you don't get any question from EBV, don't blame me. But end of the day, we cannot predict. I'm not an astrologer, but these viral infections are slightly more important. Congenital infections again. You can expect 2 to 3 questions from congenital infections. So do them very thoroughly. Where to read nephrology? Sarvan Prabhu. Nelson is good, but other than that, but excellent textbook by Dr. Bagga you can read. In addition, the latest nephrotic syndrome updates, steroid sensitive, steroid resistant, the ISBN guidelines, they are available in public domain. Download them, read them. Every word is important. Also, you need to mm, there is also a book by Elsevier in case you want to go into the details of hemofiltration and all, but that is only because only if you are targeting the INI SS exam, they're not needed for NEET SS exam. Uh, Tushar Rayani is asking, Tushar, I think you missed it out. I told this thing just before you typed this query that better answer in this case will be 2 FDC instead of 1. But it is controversial. Nobody knows about it. It's a child. Weight is increasing. It has already crossed 7, which was the cutoff for 1 FDC. So in these circumstances, normally in other conditions, if there is a band like thing where band based guidelines are there, we go in for the higher value, right? So 2 FDC will be a better answer if it is 7.5 kg child, if I have to mark. Naveen is asking, sir, plans 4 to 5 grand test, 150 like real exam. Naveen, already the day it happened, very next day I got a question asking about the key things. So I advised the team, the content team, to make such questions and have at least one grand test like that. So they will be having. So there will be one, at least one grand test will be there like that, and one demo test will be organized by NBE. Sir, I'm studying for DNB, giving my final exam. Any suggestions, sir, to deal with theory and practical? Theory, read Nelson. Practical, be particular with examination details. Now, it's a topic on which we should not be talking here because we are talking about NEET SS. But I've seen a lot of students go wrong in OSCE exam. I have seen a lot of students not performing well in DNB practical because they miss out on small little basic things. They will not take consent from the parents. They will not wash their hands. Examiner will be checking for it. He will be asking for it. They don't take, they don't perform. If you get a newborn case, they don't perform the scarf sign properly. When you're performing a scarf sign, for example, you should be gentle, should be done in a lying down child, and you should be if you're not pushing the elbow, you're only holding the elbow and pulling it like this and not pushing it with that thumb applied at the back of elbow. This is small little thing for you, but the examiner actually marks you negative on that. Most of the DNB vivas, contrary to popular expectation, people do not do bad in DNB practical because their viva goes bad, but because they do silly mistakes and their cases and their case presentation goes bad. So work on the theory part, solve some MCQs, be thorough with Nelson, be thorough with practical books, and at least follow 2 to 3 practical books instead of single one, and practice the OSCE examination for DNB. More about DNB, we can have a separate session, but not beyond this. Yes, Aditya, I agree. Arvind Bagga is the best for nephrology. Dr. Arvind Bagga is a pioneer in nephrology, and his book also. Everybody has been reading for the past decade or so. What are the commonest components in Bacterial syndrome and Charge syndrome? Satish, it's not mentioned anywhere else. Percentages I haven't seen, but I'll have a look at it definitely. I'm taking a snapshot of your question. I'll answer to it accordingly. When will SS for radiology, Revati? Absolutely no idea. Beatles, when will the remaining videos uploaded on app? Beatles, they are being uploaded. I just took a small, gentle class of the content team, asking them why videos which have been recorded, they have not been uploaded. They have assured me it will be done very soon. And I'll keep updating them, and you can keep bugging me till that time. Most common type of cerebral palsy in kernicterus. Chandrababu, it is extrapyramidal cerebral palsy, also called as choriothetoid cerebral palsy, also called as dystonic cerebral palsy, which is most common in kernicterus. Kernicterus, remember, extrapyramidal CP is the answer. TB, ADHD, ASD, like many important topics are missing. Your doctor, TB is already done. ASD and ADHD were recorded by the previous faculty, the Honorable Dr. Singhi ma'am. Uh, Once now she's not a part of the team, so obviously these will have to be re-recorded and these will be recorded and uploaded. What topics in which are like leukodystrophy and myopathy in a quick class with that? Satish, leukodystrophy, pediatric psychiatry disorders like ADHD, autism, Rett syndrome, and differentiation between gray and white matter disease. When you read leukodystrophy, focus on Canavan disease, focus on ALD, focus on MLD. And Pelizaeus-Merck disease. Pelizaeus-Merck was asked in your INISS also, just in the recent past few exams. QBank must be updated, sir. Yes, I agree. I totally agree. It must be updated. Sanket, but there was a question system about step-by-step approach or nebulization structure, chest and nebulization, which is the first beta agonist or an NAC. I couldn't understand your question. Yes, there was a question on this, which is the first beta agonist or NAC. See, N-acetylcysteine, there is which is the first beta agonist. Nelson does not talk about any such thing about which should be given first and which should be given later. Frankly speaking, beta agonists are not that useful. If you look at Nelson and if you read the guidelines of cystic fibrosis given by Cystic Fibrosis Foundation, they very clearly say that hypertonic saline N-acetylcysteine based management, although they're not very effective in younger children, and human recombinant DNAs. These therapies are more effective compared to salbutamol. Salbutamol has not been found to be that effective in cystic fibrosis, so NAC will be a better answer in that. Why are videos on RT and other nephrology topics unavailable on the app? Hema, the answer for this is technical. These videos were recorded by pediatric nephrology faculty who was previously associated with our team. Now he's not a part of the team, so those videos were replaced. Now those some of those videos which were also recorded by me, they were uploaded. Some of the videos have not been uploaded because now the contract of that particular faculty is not there. So the whatever videos are there, we'll try to make sure that those are available as a urgent basis. And right now, trust me, today and tomorrow, I'm sitting in the office only, and I'll be recording maximum number of things which can be uploaded. They'll take another week or so to appear. Please take lecture on ventilator graphics as questions came in last NEET and INISS. Ventilator graphics is asked in INISS. I'm quite sure there was a single question on ventilator graphics. The recall could not be there in NEET SS. But INISS, yes, it is frequently asked. So let us see. For INISS, we'll be taking a ventilator like a session. We'll be arranging a session like that. We can consider a session like that, but right now I can't take uh, like some more important things are pending. I have to put up videos on thalassemia. I have to put up videos on HIV, on renal tubular acidosis. I have to put up video on the CKD metabolic bone disease. So those videos are infinitely more important for from NEET SS point of view, and so they will be uploaded first of all. For INISS, we can consider it after the exam is over. Mm. Arshdeep is asking with changing pattern of exam, social media, sir, if they are important, please take classes program. Arshdeep, with the changing pattern, I don't know whether they are going to be asked or not. They may be asked, they may not be asked. Some of the things like Mission Indradhanush, etc., are already there. Some of the vaccination things have already been mentioned. We have talked about the relevant goals also. Millennium Development Goal related things they have been discussed. Some of them will try to cover in the coming days as small sessions or treasure revision sessions. Is it possible to crack the exam with 45-day preparation? Anirudh, it depends upon how focused you are and a bit of luck as well. But luck is something you cannot control. 99% thing is your effort. Stay focused. Plan 30 days, one reading, 10 days, another reading. Give all the mock tests that you can and hope for the best. If you have been a good student, most of the questions asked should be solvable. Is notes this note enough for DNB theory exam? Dr. Muhammad, no, it will be useful, but for DNB theory, it's a theory paper. You need to read in a separate way as well. You need to read the past papers. You have to have a look at the DNB past papers also. Satish, sir, will you upload a video on frequent topics topics and questions asked in previous exam? Yes, Satish, that will be a separate second video. Fine details, topics to focus on, analysis of past three papers. That will be a separate video we'll be planning. So that is why I've deliberately not gone into details of those things. Class on DSD, please. Disorders of sexual differentiation. Tricky topic, difficult topic, low yielding, lot of effort topic, but point taken. Yes, I'll talk about it. This plan lecture already told to the team 150 questions. For DNB Pediatric Practical, is it enough, sir? DNB Pediatric Practical, this course is for entrance preparation. It is more suited for theory, but it is not a practical course. There's notes already to write notes. Yes, Gurdeep, the notes revision has already been told about it. Please explain about ventilation regarding case-based discussion. Mahi Mahesh, too many case-based discussions will make it a practical course. That is something we have actively avoided unless it is a MCQ-based thing. Because then what will happen is you have 300 hours of videos available, which are impossible to do. We don't want to create, a parallel Nelson out of for your consumption. Number one, it will increase the cost. Number two, it will increase your ability to read and revise those things. So we have done them only if it is applicable. Practical things are not a part of this course. I keep emphasizing it. It's a theory based thing that we are teaching. How good it is to take pediatrics for people who want to do DM cardiology, Satvik. If you want to do DM cardiology, go in for MD medicine. Don't try to find a lateral entry. You decide later, that is a separate thing. But logically, you should be taking MD medicine or DNB medicine and then going for DM cardiology. Sir, please upload individual vaccines and diabetes mellitus. Sure, Nandakumar, point taken. Mock test pediatric SS like grand test already done, already informed. They are working on it. There will be grand test. Sir, can MD pediatrics can do DM adult endocrinology? Yes, Satvik Raj, he can. But you have to sit in for NEET SS paper. You have to sit in a paper where Harrison-based questions will be asked to you. What is the time period for steroid-resistant nephrotic syndrome? Gurdeep, it is 6 weeks according to ISPN. ISPN 2021 says failure to attain remission despite 6 weeks of daily full dose steroid therapy. Full dose will be 2 mg per kg per day. That is 6 weeks is the cutoff now according to ISPN. Kindly tell offline book for NEET SS pediatrics. I've already talked about it, Jay Arya. There is no particular book. You can pick any book for MCQ practice. For NEET SS past papers, there is a book. You can Google search it from Amazon. You can order it. It does not have explanations. Satvik Raj, my zodiac sign is Scorpio. According to Hindi calendar, yes, it's Scorpio, but according to English calendar, it's Virgo. So, Nandakumar, class on individual vaccines, Ashdeep, yes, I have already recorded it. There were changes in it according to some guideline updates. So, we held it back. It will be edited and it will be uploaded. Nelson, very recently, there are so many guidelines for syphilis. Please simplify it. Yes, Satish, I'll simplify. Bhardwaj Reddy, video and tubular disorders, except for RTA, all disorders, approach video, as well as details of Bartter, Gittelman syndrome, etc., have already been done. They have already been done. It's just a matter of they being put up. And I've told the team, I've mailed them officially also. What are the books to be completed before INISS neonatology exam? Nandkumar, INISS need neonatology, AIMS neonatal protocol, parts of Nelson, Flaherty, certain chapters of Avery's neonatology, certain chapter, retro reading. That's it. No other book needed. How much salary does a neonatologist get in a private hospital? Siddharth, it's a spectrum. On the other hand, there are people who make somewhere around a lakh, 1.5 lakh, and there are people who make close to 7 lakhs also. So it's always a spectrum. It all comes down to, I always give an example. Like I know a particular person. He's a cardiologist, right? Adult cardiologist. When he went to join in a top corporate hospital in Hyderabad, he was offered a salary of 80,000 per month, which was less than what the stipend he was getting as a resident. Imagine. The reason was simple. There is more supply of residents, there are more supply of doctors, and there was a less demand from the corporate. The same person went to his hometown and about 20-30 minute drive, that person who is a cardiologist, adult cardiologist, he joined at a place where the salary was about 2.8 lakh rupees plus incentives on the things which he was doing. That was his starting thing. And right now he's close to 4.5 lakh rupees. So it all comes down to the branch which you have, the skills that you have, which city you settle in, and how much, kind of saturation is there in that branch. So no logical justification can be made out of it. Same is true for neonatology also. If you have your own center, your responsibilities will be more, you'll have to hire people, your expenses will be more, but your earning will also be more. If you are working at multiple places, your earning will be more. If you're working only in a simple place, you'll be getting a salary out of it. So it will all depend upon your circumstances. Which guidelines used for treatment? John Carl, it's a very, I couldn't get your answer, like which guideline used for treatment. Usually, different guidelines are there for different treatments. The lectures, diabetes, pulmonology lectures are less. Okay, point noted. Any modules on image-based question? Anirudh, not many image-based questions are asked in NEET SS. On an average, 4 to 5, maximum around 5 to 6. Most of them are solvable. So no specific things, but wherever possible, I have shown try to cover the images in my sessions. Uh, so should be language transform mathematics since it is 150 question. Yes, Satish, I think you should be reading at least about Millennium Development Goals, the important key health programs, if not all. You should be reading a bit about biostats just to be on the safe side. Just to be on the safe side, because nobody knows what is going to be asked. There is one school of thought which says कि ये वही होगा जो what the old NEET SS was, with only cosmetic and changes. There is a second school of thought which says that there may be significant changes. Frankly, we do not know. So you need to be prepared for both. To join SS nephrology from Pediatrics, how to prepare? SO, I've already told you, you have to prepare for Harrison. You have to read adult medicine for that. Quick revision for topics which are volatile. Yes, Naveen Venkat, I will be taking another session on that and summarizing the areas from where analysis of past papers, areas to focus. This will be a separate video. That is why I've not deliberately gone into details. I've only touched it superficially. Pediatric neurology, Raghavendra Singh Patel, already informed, already said to the team. Most important 5 topics from CNS. Jay Arya, it is you are taking my viva. Most important 5 topics. Okay, if you are asking most important 5 topics from CNS for NEET SS, muscular dystrophies, mm, cerebral palsy, differential diagnosis of meningitis. Mm, what else? Childhood psychiatric disorders, autism, ADHD, Rett syndrome, and fifth will be. mm, 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 See, that is what happens. Brain freeze happens at that time when you ask such questions like that. Should be, I think. topics related to neurocystic sarcosis. So I think if I have to read and I have to read five topics before I sit in the exam, I'll read these five topics. As you know, most of the other mood analysis, could you please take a look on it? That will help in quick revision. Yes, Dr. Tanmay, I told you also. Right now, sitting, taking this session not from my home. I'm sitting in the Prepladder office. I had a meeting with them. I'll have a meet with them again, and will this has been conveyed very seriously. Trust me, it has been conveyed very seriously to the team, and they have also taken it seriously. And I've also informed the top management to ensure that follow up on this is also done. Neeraj class on national programs already said yes, we'll consider it. Please brief on GINA guidelines for asthma. We know I have already recorded a video. It was there. If it is not there, please let me know. If it was not there on the app, it was there on the app. I had recorded it about 6 months back. जैसे उन्होंने पहले क्या करेंगे और दूसरा तीसरा ऑप्शन नेबुलाइजेशन चेस्ट फिजियो सक्शन संकेत भद्रा just try to send me the question. I'm taking a snapshot and I'll try to make a triage thing out of it. Okay, you are asking nebulization chest physio versus suction. Okay, it's a practical thing. What is happening in cystic fibrosis is there is impacted secretions. So if you give nebulization directly, it may not be able to, help the child much. So whenever you have a cystic fibrosis child, first you do physiotherapy. It is a practical thing also which you are doing in your residency in your ICUs. So if I am a cystic fibrosis child, first you will change my position, then you will do percussion exercises. Chest physiotherapy will be done with a cupped hand. If you have device, you can use that device to do chest percussion. Secondly, you will do a kind of a bit of nebulization to the patient. Then again, you will perform chest physiotherapy. Then you will do suction, applying negative pressure, and then you will give oxygen and nebulization for delivery of drug to the patient. Chest physiotherapy has to be done before these patients, before doing this thing. Then nice guidelines on UTI. Uh, Syed Muzafin, nice guidelines on UTI. If you ask, like they are available in public domain. You can find them in case you want them. I can share it with you. While solving Qbank, everything is good, sir. But only I'm feeling tough, though I watched all your videos. Naveen Venkat, nephrology is tough. Frankly, I haven't covered the entire nephrology. Uh, RTA is, as I have been told, Barter Gittleman syndromes I have recorded, but they are not there on the app. They will be uploaded soon, right? RTA, CKD, I have not recorded. I will. I am supposed to do it today and tomorrow. I'll do it today and tomorrow, and in the next 2 3 days, it will appear. As for other topics, if you find them difficult, uh, tell me. It's a free world, and I do take criticism. I'm not like shutting out criticism. You want कि सर ये topic नहीं समझ में आया है. I will try to simplify it even more if it is needed. So don't worry. I'm your fan since 2014. Your superb keep guidance. Thank you, yours Ashish. But the way you are writing, your fan since 2014. Suddenly, I'm feeling very old. Thank you so much. Sir, update on febrile seizure. Ashdeep, yes, there is an update on febrile seizure and there is a video. I've recorded a full 1 hour video on that. But if it is not available, please let me know. On the Prepladder app, there is a complete video on update on febrile seizure. I had recorded it and there were a lot of changes. AOCN, Association of Child Neurology 2021 guidelines हैं febrile seizure की. They have even defined febrile seizure differently from Nelson. They have said कि 6 months to 5 year नहीं होता है, 6 months to 6 year होता है. So starting from definition till treatment, in treatment they say that you have in intermittent prophylaxis, oral clobazam is the drug of choice. They say it very clearly. So it is a very, very important thing. And those who were asking panch sure questions, this is the king of those questions which you have to read. Febrile seizure, very important topic. Any course for pediatric resident? Dheeraj Kumar Singh. It will be a conflict of interest if I say it here. So, yes, I am planning such a course. Not right now. This course, super specialty course, entrance course is only for entrance exam preparation and it is directed towards theory. So, it does not have any real life patients or such clinical guidelines. But in case you want theory, obviously we have stuck to Nelson. And if you want it for your theoretical belief, see, the eye sees what the mind knows. Only when you know your theory, then only you will be able to apply in the patient. If you think like that, this course is going to be beneficial to you. Sir, what is the pediatric super specialty course which is not so hectic? Anirudh, uh, everything is hectic. It depends upon how hectic you make it through. In general, genetics. Genetics. Now, some genetics people will be offended with this, but genetics is relatively less hectic, and neonatology also. Uh, Neonatology is also not that hectic, except the learning curve, which will always be there. Uh, Thank you, sir, for your 90% we have seen video, which helped me a lot along with Nelson. Thank you so much, Naveen, for the appreciation. Do we need to read all latest journals for SS exam? Not all journals are needed. In general, you should be sticking to any path-breaking new drug coming or getting FDA approved for a very common thing that you can read from any standard reference. In general, any guidelines updated recommendations in Indian pediatrics or any specific recommendations in Indian Journal of Pediatrics. These are the only two you should be having a look every month. महीने में एक दिन have a look. कोई नया रिकमेंडेशन आया है, GERD पे आया है, ओके आई एम सपोज टू रीड इट. किसी रेयर सिंड्रोम पे आया, नाम भी नहीं सुना, you can omit it. Other journals, no need to read for super specialty exam. And Tanmay, one more thing. No, no, please sir, record upload on ventilation, nephrometry. We are missing statistics also. Okay, Tanmay, statistics. I'll talk to the management. Uh, Everyone has strengths or weaknesses. My weakness is statistics. I don't teach them, but I'll ask the management if something can be done. So request for review disorder of sexual reproduction. Gopal, I talked about it earlier also. DSD is a very difficult low yield topic, but approach to DSD I'll definitely take up. At least flowchart kind of thing. कब है तो क्या answer होगा? I'll take that. Um, Pediatric subspecialty fellow was a DM in terms of practice and absorption in cities like Delhi. Karthik Ketyage, that is a separate subtopic in itself. Scope of pediatrics and all. Scope of various specialties and how you are going to benefit. I will be taking a separate session for it, right? Separate session for it. So just watch out for that session in the next weekend. Just watch out for that session. For now, I would say that it all depends upon where you want to settle. If you want to do a nephrology, nephrology, DM neonatology, and are thinking that I should go and immediately get the top corporate hospital should give me a 3.54 lakh salary and they should welcome me with open arms, that is not going to happen. Delhi, there are a lot of very good neonatologists. So there will be some a bit initial struggle you will have to do. On the other hand, if you are going to say a city like Rohtak or Meerut, then obviously it will be relatively easier for you. So it also depends upon the city that you're going to practice. Can you know how to perform it? All the questions exam hall completed within given time that we can revise in the answer? Yes, definitely. Definitely, Tanmay. इस तरह की बातों में I like talking about all these things. I'll definitely do it. Definitely, for sure. That I'll do it as a session here, not on the app. Osmolality, alveolar oxygen gradient, other such questions asked in super specialty exam. Okay, Bismillah. All these, pointer based things, how to calculate kind of things, how to calculate this, how to calculate that, which do not definitely come into a particular domain or a particular topic. I think that can be done as a kind of revision sessions. In fact, I can take it as a revision session in case you are ready for it. Will it follow mostly Harrison based or specialty? Vishnu Shankar, NEET SS, if you are targeting medicine, you have to read Harrison. If you are targeting pediatrics, you have to read Nelson. As simple as that. And you can drop your questions on Telegram channel, and I will answer it again. I'll come again. No issues with that. Thank you. Brother. I cleared my DNB theory and OSCE practical exam. Congratulations, Soumendra Ranjan Nayak. This is a huge thing. See, DNB theory and OSCE practical exam. If you clear it, and if I had 0.01% contribution in it, thank you. You made my day. Nand Kumar, you're welcome. How many questions on biostats? Praveen Kumar, nobody knows the distribution. There may be questions on biostats, there may not be questions on biostats. Normally, biostats is not asked in NEET SS, but they may be asked in the coming exams. So nobody knows about it. In INISS, biostats always has 3 to 4 questions. Class on dengue, please. Okay, Ashdeep. See, everything cannot be taught, frankly. Everything cannot be taught. Things which cannot be taught, but they are important, or everything cannot be put on Prepladder. I'll keep on trying to take sessions on them and putting up updates on them. You can also post on my Telegram channel also. We wish entire topics to be taken by you. Anirudh, I will have to take entire pediatric neurology because I will have to do it. I will have to do it because the older videos will no longer be available because of copyright thing. So I'll have to do it. So I I think the session has extended a lot. So there is another session which is to be done, and people are looking at me with uh, puppy eyes to finish the session fast. So it was lovely interacting with you all. There were a lot of academic queries I answered. Some of the academic queries I did not answer because percentages and controversial things. I would not say something wrong and then you remember the wrong thing. I have taken snapshots. I have made those notes here. I will update them. Just remind me once again about those queries which you had. And do like, subscribe to the channel. And I'm every 5 p.m. we'll try on Thursdays. We'll try to meet again. So we'll try to, go into a regime of meeting up on Thursdays at 5 p.m. and discussing some of the queries. So paper strategy, areas to focus, particular analysis of the past papers that I will be coming up soon. So catch you all again. No, Karthik, not every gene name and chromosome number is possible, but at least the important diseases. If you don't know the cystic fibrosis में 7p है या 7q है, then it is troublesome. But if you don't know it for some rare syndrome which you are reading for the first time, it is absolutely fine. Flashcards or quick revision thing, Tanmay, technical things related to app, they are not in my hands. My job is to create academic content for you people and convey your concerns. That I'm doing already. Flashcards I cannot promise. Really sorry. जो नहीं होगा यार वो नहीं करेंगे बात. But जो videos हैं, जो content चाहिए, जो मेरे से चाहिए, that I will be definitely willing to do. Right. So thank you very much. It was lovely interacting with you all. I'm tired. It's time for a coffee for me. You also, please get on with your studies. Thank you so much. Thank you. Right. So thank you very much. It was lovely interacting with you all. Tired. It's time for a coffee for me. You also, please get on with your studies. Thank you. Thanks, Amit. And most of them were long journeys.